Morning.
For any of you that don't know, I'm Bobby Howell, Bowie County Judge. This morning we had a meeting with representatives from our cities and counties, along with local health care providers, first responders, education entities, all came together to collaborate on a plan that provides a high level of preparedness for our community. We have been on continuous alert for updates regarding the COVID-19 outbreak and its impact on our locality and our region. I have been so impressed by the communication provided to our communities from all levels of state government. On the local level, we have protocols in place and our personnel are trained and ready to respond. And that's the prepared statement, and I'm open to questions.
And are there any confirmed cases in Bowie County of coronavirus?
There is not.
How are we training them to respond?
The training that the professionals have is ongoing. That's what they do. The first responders, the doctors, the nurses, emergency management coordinators, the EMTs, the LifeNet, ambulances, that's what they do. They are trained professionals.
If someone is exposed to the coronavirus, how many times are they being tested? There's been cases where tests have come back negative, but people actually turn out to have the virus.
As far as testing, I think that's an open question, and that's a medical question that I'm not able to answer. We have in the protocols to make the appropriate contacts to have someone tested if the medical professional thinks they need testing. Dr. Collins is here from St. Michael. Do you have anything else you want to respond to on that?
Sure. So,
Could you come to the microphone?
Yeah.
Go ahead.
Give us your name.
sure. Dr. Lauren Robinson, Vice President Medical Affairs, Christus St. Michael Health System. Could you repeat the question?
How many times are people being tested for the virus once they've been exposed to it?
So for someone to be tested, basically what needs to happen is they need to be evaluated to see if their symptoms and if their history is something that's consistent with needing a test. Usually what would happen is that they would need to talk to their doctor or talk to a doctor in an emergency department who then calls the state health department to determine if that's somebody who indeed needs to be tested. If they do need to be tested, in addition to testing for the COVID-19 virus, they're assessed and tested for other things that could be causing their symptoms. And then based on a conversation between the doctor and the health department, they determine if they need to be tested for COVID-19, and if that's the case, they will be tested.
The government has said that by the end of this week, anyone who wants a test will get a test. How close is this area to being able to adapt to that as far as having the testing kits available?
So the statement by the government, I think, is to let people know that we have resources available in our communities. Here in Texarkana and in Bowie County, we do have the ability to do the physical test and then send it to a lab to be evaluated. We're not doing the actual lab testing here in Texarkana. The lab that is closest to us is the Tyler lab. There also are private labs, so something like a LabCorp that also has ability. I can't speak to those capabilities and how that testing process goes, but the way that this testing works is that someone not only needs to have an exposure, but they also need to have symptoms, and so those conversations about needing a test would need to be between a person and the doctor who's evaluating them at that time.
Have we already been utilizing the test here locally?
We are able to provide doing the testing in the emergency department or in a doctor's office. Some of the doctor's offices in town have the private testing available. Those tests all do need to be sent to Tyler to be run. So we can't run a test in any of our local labs in our local area. We can do a swab, which is a nasal swab, and then send it to the lab to be evaluated.
What's the turnaround on the results?
So there are differing turnarounds based on what lab is sent to. The information that we have been provided from the Tyler State Health Department lab is that that lab takes approximately 6 hours to run. That is not the amount of time that it is resulted in, but the actual time that it takes for the lab from the start to the finish is approximately 6 hours.
Can you tell us more about that coordination with the state level? Who are you communicating with in Austin and Little Rock? What are they telling you? What information do they require of you?
So I am not the person who would be calling the health department. It would be the person who is taking care of the patient at the time. So that could be not only at Christus St. Michael, that could be at Wadley, that could be wherever the person is being assessed. A doctor or provider is assessing the patient and will then call the health department to say, these are the symptoms that the person has. This is the travel history that the person has or does not have. And then the health department helps the doctor say, this is someone who should be tested for COVID-19, or we don't think that this is the case, but you should test the person for these things. As you all know, we're still in flu season. So anyone who is getting a COVID-19 test is also getting a flu test at that time, because we do need to make sure that we're staying vigilant about keeping track of the flu in our community as well. And then from that conversation with the doctor or with the epidemiologist on the call, they will make the decision about if that COVID-19 test will be performed.
If you get COVID-19, what's the percentage chance of death?
I am not able to answer that. If you look, there are a lot of different competing resources and information. The best information about the outcomes of the COVID virus and the death rate would be available from the CDC.
Judge, can you give us an update on any discussions you've had with the nursing homes in the area, since nursing homes in the country are the most heavily affected by this virus?
I cannot give you an update. We have not.
Excuse me.
It's all right. We have not reached out to the nursing homes. We will be doing that within the next day or so, if not sooner. We did not. This meeting that was called today was rather hastily called, in part to try to assure the community that our community professional healthcare people and emergency responders were equipped and trained and ready to adapt to whatever situation presented. And unfortunately, we did not, I didn't, and I'll take the blame for that, did not have a chance to contact the local nursing homes, but we will be reaching out to them soon.
Are there any plans to take any special precautions in jails and prisons and other concentrated populations?
As far as the Bowie County jails are governed by the Texas Jail Commission, and they put out whatever standards they go by, which includes some healthcare professionals that are on duty, on staff, and on call. And while I haven't seen those, and I don't believe Sheriff Neal is here, but I'm sure they have their own protocols. They're going to be the same as everybody else. Any other questions?
Does the state have the ability to come in and say, stop gatherings here, or would that be a local decision?
It's local, and I'll quote you from an email update that I got last night from the Texas Department of State Health Services. And it says specifically that local city and county officials have the authority to make decisions about closures and event cancellations, and those types of decisions are made at the local level. And that's the position the state has taken. And I think it's going to be on a case-by-case basis.
Have you talked about any criteria that would trigger you saying, no, probably you shouldn't get together?
No, I think it's something we're going to have to look at on a case-by-case basis. And I don't care if it's a local school district, a business, or a government office. We're all going to have to look at it and see what happens and as it unfolds.
Judge, since viruses don't recognize state boundaries, are you working with your counterparts on the Miller County side?
Yeah, the meeting we had today, we had officials from both sides of the state line. We had a group that well over 50 people, I'm sure. I don't have an exact count, but we had the Miller County judge, the mayor from Texarkana, Arkansas, the emergency management coordinator from that side of the state line. the police chief, Bob Harrison from the Texarkana, Arkansas. I think the sheriff from Miller County was here. So we had a good representation from both sides of the state line. On the Texas side, of course, we had our Bowie County representatives, including myself. We had the Texarkana, Texas City represented at all their levels: fire department, police department, emergency management coordinator, their city management, city manager, Ms. Jaster's here. So we had a cross section. In addition, we had all the major school districts had representatives at the meeting. And we had the major fire departments and volunteer fire departments were here. So we had a group that met and exchanged some ideas and some information and discussed the situation that we are potentially facing. But it was a great meeting. We've got some great people. And I want to say they all came together in a short time to have this meeting.
What should someone do if they suspect they've been exposed or if they think they're showing symptoms?
The guidelines provide that they call their physician or their primary care physician, not even go into the doctor's office or to the emergency room. But as a practical matter, that's what many people are going to do. But the guidelines say to make a call, and the problem is a lot of people don't have a primary care physician, so those people will wind up either in the Bowie County Health Clinic or at the emergency room at one of the local hospitals.
Are hospitals preparing for a big flood of new patients? Do you expect to be overwhelmed?
I don't think so, but I don't know that they know. As far as a big influx, at this point, it doesn't look like we're there yet. There may, certain areas of the country, according to what I read, have had a rather large outbreak. But in this area, the case I read about today in Longview was the first confirmed case in Northeast Texas. So it's too early to say that we're expecting an influx. If there were to be a local outbreak, as opposed to a travel-related outbreak, then it's yet to be seen how many people and what a burden that would be.
What is the difference between a travel-related one and a local one?
As I understand it, and I'm not a medical professional, but that travel-related is someone who is exposed or contacts the virus due to traveling in an area where there has been an outbreak. The local outbreak is where someone comes down with the disease and hasn't traveled anywhere else. It originated locally, and from what I read, there's been very few instances of that. Did I state that right, Doctor? Okay. The Texarkana Gazette did an excellent job today with their coverage of the COVID-19, and they had excellent articles that have most of the guidelines. They all sound simple. Wash your hands and don't touch your face and stay away from crowds if you can. And here we all are.
Small room.
It is. But the Texas Department of State Health Services has a website that has a lot of good information. On the county level, and I'm pretty sure at all the levels, and that's one of the reasons we had this meeting, we get 3 or 4 emails a day. I do, as county judge, 3 or 4 emails a day updating on the status of the COVID-19. There's a daily conference call put on by the state at 4 o'clock every afternoon. And you can dial in and listen, and you can also participate. You can ask questions during this statewide conference call. I've been impressed with the response that our state has put out. There's been all kinds of guidelines and protocols issued. Does that mean they're perfect? No. But I think our community should feel really good about the way our local professionals and our state has handled this situation.
Could someone maybe address how hospitals or the city has prepared for this up to now? Have you had any sort of drills or exercises to prepare you for the eventuality of such an outbreak?
Shelby?
Hi, I'm Shelby Brown with Wadley Regional Medical Center. And I think the judge said it, that this is what we do. We are prepared for emergencies all the time, both Wadley and Christus. And so this is no different than a flu pandemic for us in what we're trained to do. But yes, we have meetings, we follow it on an hourly basis, and we have phone conference calls as well. All of our staff has been trained, and we are screening everyone who comes in the hospital as a patient. We have just instituted for non-emergent cases, say an MRI or you're coming in for day surgery, that we're going to call and ask the questions before you get to the hospital. And we are also looking at limiting visitation. And I think we both want to calm the fears that this is prevention. And we just are taking these steps, not because we think, oh my gosh, it's coming, but this is just the right thing to do, that you shouldn't bring children into the hospital. I mean, we're still experiencing lots of flu. That is more, if you will look at the stats, in America is what we're facing. And those elderly people that have comorbidities or have other issues, health issues, they're the ones at risk. So be assured, I think, from both hospitals that we are prepared, and we meet regularly with our staff so that they are prepared as well.
Anything else?